Hi everyone, my name is Carol Cameron Matthews. I'm a DNP student attending the University of South Alabama. My project title is Medication Non-Adherence in Adult Patients Diagnosed with Schizophrenia. Why is this topic important? Schizophrenia has no cure, but it can be effectively managed with antipsychotic medications. The challenge for providers is patients are non-adherent with medication. Medication non-adherence has been linked to poor patient outcomes, reduced quality of life, suicidal homicidal events, worsening prognosis with successive relapse, cognitive and behavioral disturbance. What is the purpose of this project? 50% of patients attending project's private practice facility are non-adherent. Only 10 to 20% are able to secure and maintain competitive jobs. Patient experiences frequent acute exacerbations and hospitalizations. Prognosis after successive relapse is poor. The purpose is to improve medication adherence by 25% using the evidence-based STAY initiative. The need for this project is to close the identified gaps in patient delinquency for improved patient care and outcomes. Schizophrenia is a mental disease of the mind, and it presents with hallucinations, delusions, paranoia, erratic thoughts, speech, and behavior. Recurrent rate of symptoms for patient experiencing first episode of psychosis is 77% within 1 year and 90% within 2 years of medication cessation. This tells you how serious this problem is. Non-adherent patients experience more frequent readmissions, increased length of stays, and they are more severely ill on admission. Non-adherent patients also are more likely to experience relapse of psychosis, persistent symptoms, and perform suicidal attempts or completions. The project started with 24 non-adherent adult patients diagnosed with schizophrenia. The site is a small private practice outpatient facility offering mental health services and substance abuse management. The patients were asked to fill out the positive and negative syndrome scale, which is the PANSS. The PANSS assesses the positive symptoms of schizophrenia, for example, delusions and hallucination. It measures the negative syndrome of schizophrenia, for example, emotional withdrawal, blunted affect. It also has some questions dealing with anxiety and tension and some of the related syndrome that are present in people with schizophrenia. They were also asked to fill out the medication adherence rating scale, which is called the MARS, and this assesses the patient level of medication adherence. They also fill out the Helping Alliance questionnaire, and this assesses the level of therapeutic alliance or rapport that the patient shares with his provider. The STAY initiative was implemented. The STAY initiative has 6 principles, and it was developed to help patients remain medication adherent. At the end of the 12 weeks, patients were asked to complete the same measurement tools to see if project goals were attained. The STAY initiative has 6 principles. 1, the assumption that most patients are at risk for partial or total non-adherence at some point in their lives. This takes into consideration that adherence can be an overt problem or it could be a covert problem. Covert adherence is more common, and therefore clinicians often have difficulties in determining if patients are at risk. Understanding the risk factors for non-adherence, such as poor insight, previous non-adherence, current or past substance abuse, negative attitude towards medication, all these factors help the provider to identify patients that are at risk. Number 2 is a good therapeutic alliance is the key to identifying potential adherence issue. Therapeutic alliance can be strengthened by developing a no-blame, non-judgmental environment through the use of open questions, listening to patient and family members, establishing trust, respect, and empathy. Patients should also have the opportunity to be informed about their medication, to have informed consent about their treatment goals in partnership with their providers. Number 3 is creating a tailored plan to meet the individual needs. This involves informing the patient about available treatment and working with the patient to choose the best medication route that is suitable to the patient. Number 4 is involving family members in care and psychoeducation of the patient and family member. This involves providing education to help improve insight and attitude towards medication, using compliance therapy or cognitive adaptation training. Number 5 is ensuring optimal effectiveness of care, and this is exploring different therapies that can optimize the effectiveness of care. For example, psychological therapies, psychosocial interventions, cognitive behavioral therapy, and art therapy. The last one, number 6, is ensuring effective continuity of care. This involves a multidisciplinary and comprehensive approach to avoid fragmentation of care. For example, if a patient is transferring from inpatient to outpatient, continuity of care is critical in this stage. Since our project is based on medication adherence, we will look at the medication adherence scale. I will not go over all the questions, but I just want you to see some of the responses that we had gotten from the patient when they fill out the MAR. Now, most of these questions are questions that attempt to clarify if the patient is medication adherent. For example, question number 1, do you ever forget to take your medication? Now, in the pre-project time frame, we noticed that 24 patients said yes. So all the patients had forgotten to take their medication at one point or the other. Now, in the post-project, we see that only 10 patients said yes to that question. Let's take another question. Are you careless at time about taking your medicine? In pre-project time frame, 20 patients said yes, and in the post-project time frame, only 5 patients said yes. So we see there is an improvement. Now, for the total aggregate score of all the yeses, it recorded 181 in the pre-project time frame, and for the post-project time frame, it was 110. This translates, when I did the percentage, to a 29.5% improvement in adherence. So let's look at the results of the MARS. Baseline medication non-adherence mean score was 75.5%. Post-project non-adherence mean score is 46%. This translates to a performance improvement mean score of 29.5% in medication adherence. Now, we wanted to see if we could achieve a 25% increase in adherence. We actually had a 29.5% in medication adherence. So now we look at the results for the PANSS. Aggregate positive symptom score pre-project recorded at 36.63 and post score recorded at 14.83. Difference in positive symptoms in pre versus post records a reduction of 21.80 in the positive symptoms of schizophrenia. So this means that the patients were reporting less positive symptoms of schizophrenia after we had implemented the STAY initiative. Aggregate negative symptom score pre-project recorded at 28.04 and post scores recorded at 12.92. Difference in negative symptoms in pre versus post records a reduction of 15.12 in negative symptoms. So this is the same scenario. The patients are recording less negative symptoms of schizophrenia after the implementation of the STAY initiative. Composite score for positive symptoms pre-project recorded at 8.59 and post score was recorded at 1.91. So the composite score is calculated by taking away the negative score from the positive score. So the difference in composite score in pre versus post records at 6.68, which reflects the degree of predominance of the positive score in relation to the negative score. So now we're looking at the ELPIN Alliance questionnaires, and remember that the ELPIN Alliance gauges the relationship or the therapeutic alliance between the patient and the provider. The total mean score pre-project recorded at 4.42. The total mean score post-project recorded at 5.98. Difference is an improvement of 1.56 in the therapeutic alliance between provider and patient. So now we get to discuss the findings. The STAY initiative was successful in helping to improve patient outcome in all areas under review. The PANSS, the results suggest a reduction in the positive, negative, and psychopathological symptoms of schizophrenia in pre versus post scores. The ELPIN Alliance, the results suggest an enhanced patient-provider therapeutic alliance. And for the MARS, the goal of an improvement in medication adherence over the 12-week period was surpassed by 4.5%, recording at 29.5%. The result of the MARS, PANSS, and ELPIN Alliance questionnaire suggests that incorporating the evidence-based STAY initiative positively correlated to improvement in medication adherence. The STAY initiative offers providers a comprehensive approach to medication adherence, which has proven to be successful for this project in surpassing its goal of improving medication adherence by 25%. Future projects should continue to focus on the issue of medication and adherence and explore ways to build on the tenets of the STAY initiative to improve the efficacy of patient care and outcome. Thank you for listening.